As plastic surgeons in the age of COVID, we have to care for our patients while preventing transmission. That's why the authors of this new Hot Topics article detailed key COVID safety recommendations for plastic surgery and its related disciplines. For outpatient evaluation, the authors recommend dome-shaped N95 masks and eye protection to prevent potential ocular transmission, even though that risk is quite low. For emergency room evaluation, consults with surgeons should be conducted via telemedicine if possible, to avoid unnecessary in-person visits and contact. When plastic surgeons do need to go to the ER, surgeons need to wear full PPE. Preoperatively, patients need to be tested for COVID. If positive, the risks need to be assessed before any surgery is recommended. Some operations that are elective can wait. Others, however, cannot. During the operative procedure, the authors recommend negative pressure rooms, avoiding techniques that make surgical smoke exhaust ventilation systems to remove unavoidable smoke, and special care when performing tracheostomies. The authors also recommend COVID safety considerations for specific plastic surgery procedures, including deeming all head and neck reconstruction patients as high risk even if they test negative for COVID. Due to the high concentration of a viral load in the head and neck area, especially in the mucosal areas, one needs to weigh the positives with the negatives. Weighing if tumor removal surgeries can be postponed without increasing risk of cancer growth, decreasing the volume of certain staged operations, and allow patients to stay in the procedure room for the entire time, as opposed to risking exposure in the waiting room. Potentially postponing breast reconstruction following mastectomy and non-emergent extremity and hand surgery has also been advised, and deferring cosmetic operative and non-invasive procedures as well. Depending on the current COVID spread in your community, and I know it's improving currently, some of these guidelines may not be required. But this paper is as relevant as it ever was globally early in the pandemic, because we're truly not quite out of the woods yet. We must continue to keep our patients and our surgeons safe as we continue to battle this pandemic that has affected us globally. To learn more about patient safety always in plastic surgery during COVID and beyond, read the #1 journal in the field at prsjournal.com.